Good morning, everyone. Yes. Let me introduce myself. My name is Somya Yimonte. I'm a PhD student from College of Public Health Science, Chulalongkorn University. The corresponding author of my study is Associate Professor Dr. Wattasi Sirion from College of Public Health Science, Chulalongkorn University. So now, I would like to present about my research project, and title is the Occupational Health Study on Lower back muscular discomfort and associated factor in bus drivers, postural analysis and baseline finding from Yangon, Myanmar. So now, what is lower back pain? Lower back pain means pain, stiffness, or muscle tension, and it is a symptom between the back torque and the lower back and the lower wrist margin. It can be acute, subacute, and the chronic. So, and the occupational lower back pain is originally due to the working environment. And this occupational disease can be multifactorial. It comes from the physical, organizational, psychological, individuals, and socio-cultural. Now this is global prevalence. Globally, the global prevalence of the lower back pain reached 619 million individuals in 2020, and it is estimated to be 843 million cases by 2050. In Southeast Asia region, we can see that there are 47 million cases in 2020. There is a severity of the lower back pain, the sickness. We found that there are over 319 million young with disability cases in 2020, and in 2019, the 126 million cases are due to the occupational economic factors and around 216 billion economic losses. Globally, the median percentage of the all hospital admission due to the lower back pain was 0.9%. The impact of the lower back pain can be the work absenteeism, work constraints, and declining quality of life, and severe disability. So this is the prevalence of the lower back pain among the professional drivers. The professional driver have a 3 times risk of developing lower back pain compared to the general population, and those was 10 times higher than the truck drivers. In the global population, the prevalence of the lower back pain was around 56%, and long-term driving tasks, physical efforts, full body vibration, manual material handlings, and overbustures are the main influencing factor for lower back pain. This is my research of my study. In this study area, workplace ergonomics are not properly implemented. And also, I found that there is no sufficient evidence regarding the prevalence of the lower back pain and its contributing factors and the ergonomic risk level among the bus driver. So this is my result objective of my study. The first objective is to determine the prevalence of the lower back discomfort among the bus driver in Yangon region. And the second objective is to determine the risk level and the required action for the intervention. And the third objective is to find the association between the general characteristic, lifestyle factor, driving-related factors, psychosocial factors, and ergonomic levels and lower back discomfort among the bus driver. This is the conceptual framework used in my study. The dependent variable is a lower back discomfort, and the independent variable is the general characteristic, lifestyle factor, driving-related factor, psychosocial factors, and ergonomic risk level. Now let's move to the methodology part. The study design of my study is the cross-sectional analytic study. The study setting is YBPC and YUPT, public company. The study population is all bus drivers who were operating unkind buses at those companies in Yangon region, Myanmar. The sample size is the total 134 population, calculated based on the cohort formula from the previous study. The timeline is between the February and March 2022. This is the inclusion and exclusion criteria. I included the participant with the age between the 23 and 49 years, and also had a minimum of the 6 months of experience. They were permanent employee workers, and they were able to participate and had the experience of 1 or more symptoms in the lower back region in at least once in the previous 7 days. I excluded the participant who had a history of traumatic injury, major surgery, higher BMI, and their symptoms are non-work related, or they have neurological symptoms, and they have ongoing treatment at the time of the data collection and excluded those participants. Now, this is my sampling procedure. There are 19 published best companies in Yangon region. And then I choose only two, one UPT and one BBC best company by purposefully sampling. And these two companies, there are 7 baseline numbers. First of all, I make screening based on the inclusions and exclusion criteria. After that, I recruited the participant by proportionate sample random sampling from each baseline number. This is a standard questionnaire I use in my study to measure the lower back discomfort, psychological demands, working stress, job satisfaction, and supervisor support. Based on my pilot study, the combat alpha are above the 0.7, and IOC will also check for contact validity with 3 experts. There is an observational checklist. I use the ruler test list to measure the posture of the best drivers. So for the ethical consideration, I received the ethical approval from Chulalongkorn University in Thailand and also the approval from the Defense Service Medical Research Center in Myanmar. For the statistical analysis, I use bivariate and multivariate binary logistic regression model to find the association between the dependent and independent variables. So this is my research part. Half of them of the participants are above the 35 years old, and 53% of the participants are normal body weight, and around 69% of the participants are above the waist circumference 90 centimeters. This means that they had abdominal obesity. And majority of them are high school level and were married, and half of them and they are monthly household income above the 375,000 checks. We can see that for lifestyle factor, majority of the participants are current smoker, current smokeless tobacco user, current drinkers, and the majority of them are physically sufficiently active in nature. These are the driving-related factors I measure in my study. For the driving duration professions, the median value is 25 years. And for the driving experience in current best company is around 24 months. And the trip duration is around 57 kilometers. For the driving duration per round trip is 141 minutes. For the rest break daily between each round trip is about 34 minutes, and the driving duration daily is about 298 minutes, and the median value of the working day in the previous month is 25 days. For the psychosocial factor, we can see that half of the participants, majority of the participants experience a high level of job satisfaction, high level of psychological demands, and moderate level of stress. And half of the participants achieve the higher supervisor support. This pie chart shows the prevalence of my lower back discomfort among the best drivers. In this picture, we can see that 58% of the best drivers experience the severe level of lower back discomfort, followed by moderate level and the mild level of lower back discomfort. So this is the postural analysis and the required action level for intervention. In this table, we can see that the green, the score for the right-hand side, the level of the risk is a green when it's no risk. There is no risk. We can see the upper arms, lower arms, wrists, and the legs have no risk. And the light yellow is a low risk, mild risk. You can see the mild risk in the neck, trunk, and the score is got the mild risk. And the combination of the neck, trunk, and leg, and the whole body score is the moderate risk, is an orange color. It is at action level 3. This table is finding the association between the dependent and the independent variable. I found in my study is BMI, smokeless tobacco consumption, physical activity, trunk posture score, ruler B scores are significantly associated with the severe lower back discomfort. This is a possible reason why higher prevalence of the severe lower back discomfort in my study. In my study, the prevalence of severe lower back pain is very higher in the previous study. This might be due to the smaller sample size, different operational definition, evaluation to the study population. In this study, I included the mixed population, and also I've observed the driving seat do not have the lumbar support, and I also recruited only the best driver who are not previously trained in the ergonomics. So in my study, the ruler score of the whole body score is very higher. This is about 79.9%. So they are at moderate level and action level 3. This means that the working condition need to be investigated and changed on. So why happening this higher score in my study is might be due to the lack of the lumbar support or poor ergonomic awareness, and the company do not have existing preventive measure to reduce the ergonomic hazards. So there is a further association with the lower back discomfort. First of all, I want to present the BMI associated with my lower back discomfort. Compared to the participant whose body weight was underweight, normal weight and overweight had the 0.15 and 0.08 times, had higher or having severe lower back discomfort. This might be due to the use of the BMI for its ability to distinguish the difference between the body mass and the fat is very weak in men. And also, a few studies also reported the association between the overweight or obese and the lower back pain is weaker in men compared to the women. The next associated factor is a physical activity. Physical inactive participants had 14.83 times higher odds of developing severe lower back discomfort than physically active participants. This might be due to the increase the beta endorphin levels and immunological profile, and regular exercise can help can help the bed muscles stronger, so they can enjoy the expected forces from the environment. So there is a smokeless tobacco consumption compared to the never and the former users. Current user who reported current users 0.11 times higher odds of having the severe lower back discomfort. This can be explained by the nicotine. Nicotine have acute analgesic effect on the lower back discomfort, and also nicotine can the reduction of the stress and anxiety and depression, which has been shown to associate with the lower back discomfort. There is a ruler trend score. Ruler trend score, at least 3, where 17.94 times as likely to have the severe lower back discomfort than low score or 2. This might, the possible explanation behind this association is this very slight contraction of the muscle can decrease the tissue oxygenation. This can reduce blood supply to the muscle. And also, slant sitting, this means the awkward posture, can make the passive stretcher of the spine. But what is a passive stretcher? Is a ligament connective tissue or something, maybe bearing more loads, and resulting in the activation of the pain receptor. So the last one is a ruler B score, the combination of the neck, trend, and leg score. They're also developing severe lower back discomfort was 29.32 times more likely among the participants whose ruler B score was 5 and above than those with the ruler score of 1 to 4. This might be due to the sitting without full support lead to the lumbar spine curvature, increase the lumbar spine curvatures and equal distribution of the loads, and the muscle tightness can contribute to the increased lumbar lordosis. This lordosis can result in the stress on the passive stretcher of the spine. So there is a model of the hierarchical control according to the NIOSH. Dr. Walker had may I explain a little about this? The first session is elimination of the risk factor. to post the well-being of the worker. And the second one is the substitution if the elimination is not possible. Substitution, for example, policy, the programs of the practice, and the redesigning, that means modification of the workstation, and the education and the encouragement of the worker to change their behavior. Based on my finding, I use this model to recommend the next intervention program for sustainability. So I would like to recommend for prevention and control of to reduce the severe lower back discomfort is the first one, engineering control, administrative control, and PPE. For the engineering control, I use the redesigning, modification of the workstation, like seat adjustment and steering wheel adjustment to make fit the working environment and the bus driver. The second one is administrative control, like provision of the ergonomics awareness training and workplace exercise programs, such as specific exercise like stretching exercise to specifically focus on the lower back to reduce their severity, and annual medical checkup or regular medical checkup should be provided. And other administrative control. For the personal protective equipment, it should be recommended to provide the adjustable lumbar support to relieve their back pain. This all recommendation is based on the OSH guideline, control of the hierarchy. Now I would like to present about my strengths, limitations, and recommendation of my study. For strengths, this study is a very first study for the lower back pain, lower back discomfort prevalence and its associated factors in the Myanmar. And the second strength is the researcher myself did only the postural analysis, so inter-observer bias can be reduced. And I can control the risk of the workstation because I choose only the similar best model. And the last part is a generalizability. The result of my study can generalize to the bus driver in other regions in Myanmar and other bus driver in other countries. For the limitation, I did not include the whole body vibration measurement, and the responses of the bus driver might be underestimated or overestimated. I only focus quantitative findings in my study. That's why in the future study, I would like to recommend the objective measurement of the whole body vibration, physical examinations of the use of the medical devices, and also longitudinal study to validate the findings, and mixed method study using both quantitative and qualitative in nature. And also in the future study, I would like to recommend them to find the effectiveness of the SAM intervention program by using this approach. Engineering control, administrative control, or PPE, comparison between the control group or intervention group to find which one is more effective to reduce the lower back pain. Now, I would like to make an acknowledgement to the 90th anniversary of the research scholar from Chulalongkorn University for giving me the research grant, and the Ministry of Industry, Electricity, and Yangon Region and Transport Committee for giving me the permission for data collection, and the heads of the bus company for effective cooperation and the coordination with the bus drivers. And also, we'd like to thanks to all bus drivers for voluntary and active participation in my study, and all research assistants for their time to devote in my study throughout the process. Yeah, thank you very much.